quando usare gli steroidi, quando usare l'acido ialuronico. Parliamo ovviamente del loro utilizzo nella terapia dell'osteoartrosi. È un tema che è stato dibattuto qui all'ISIAT a Barcellona durante l'International Symposium of Intra-Articular Treatment e ne parliamo col professor Raman, professore all'Università di Hull in Gran Bretagna, che appunto ha sostenuto la tesi che l'acido ialuronico di solito è da preferire. Quindi le abbiamo chiesto un po' le ragioni di questa cosa. Professor Raman, why you said that hyaluronic acid is better than steroids for treating osteoarthritis?
There is plenty of evidence, a plethora of evidence to suggest that hyaluronic acid works much better, particularly in patients who've got early arthroarthritis in young patients for a long period of time. And there is also good evidence to show that repeated doses of hyaluronic acid are effective in controlling the disease, controlling the pain, and improving function. If you look at a steroid cannot be safely given for repeated doses. The effectiveness of steroid is only very short-living. It does not last for more than 1 to maybe 4 weeks. And after that, you're pushed to give another repeat treatment. So because of the effect that does not last as long as HA and the chondrotoxic effects, potential chondrotoxic effects of steroids, I prefer hyaluronic acids over steroids for treatment of long-term osteoarthritis.
Do we have comparative data, and in generally speaking, which are the data supporting your position?
Okay. There's plenty of comparative data between hyaluronic acid and steroids. There's one study by University of Louisville in Kentucky, where they looked at comparing osteoarthritis and triamcinolone acetate, which is a steroid, in treatment of osteoarthritis of the knees. And over a period of 6 months, it was clearly shown that the steroid is inferior to hyaluronic acid in treatment of symptomatic osteoarthritis of the knee.
And there is still a space, a role for steroids? Which is your position?
I think there is still a role for steroids, particularly when there is an acute inflammatory reaction, or when you have an inflammatory response of osteoarthritis. If the knee or any joint is swollen, is got inflamed, and there is an acute inflammatory response, then steroid is better than hyaluronic acid. For
Short-time therapy.
Very short-time therapy, yes.
What does it mean, short time? 1 week, 2 weeks?
No more than 3 to 4 weeks. Less than 4 weeks is short efficacy treatment, yes.